Good morning, Dr. McDonald, and thank you so much for joining us. We heard
Morning.
from you this morning on our conference call about the difficulty you're having and your patients are having in accessing care. Can you give us a little information as a psychiatrist, what you're seeing as a result of the economic and basically healthcare shutdown in this country?
Definitely. I'm a child and adolescent psychiatrist with a private practice in West LA. I've been working for about 10 years in private practice. Before that, I did work for the juvenile justice system, seeing and treating incarcerated youth for the Department of Mental Health in Los Angeles. I also have a lot of experience working with hospitalized patients, particularly youth, as well as inpatient and outpatient substance abuse programs. So I've got a lot of experience with different types of illnesses, different patient populations, all focusing on children and adolescents. What I've seen in my practice in the last few months has been nothing short of devastating. I have had a decline in follow-up visits of about 50% for my established patients, primarily due to fear of coming into the office. Patients have called, patients' mothers have called and said, we won't come in. And when I ask why, they say either they're afraid of catching coronavirus and dying, or they were told not to, meaning that they believe that they were informed by local officials or the media that no one is to see their doctor, just as no one is to leave the house. Stay at home means don't see your physician. No matter how much I educate, I can't get through to most of those patients, although a few do come by and will agree to see me. I've had virtually no new patients see me in the last 8 weeks. I generally have 1 to 2 new patients per week. I think I've had 1 or 2 in the last 8 weeks. And I know that people are not well because my current patient population calls me incessantly, despite not coming in, to let me know that they're suffering from worsening of their symptoms, either depression, anxiety, drug cravings, or hallucinations or psychosis. And there's very little that I can do. I can't refer them to programs in the community because all of the AA meetings and other 12-step program meetings are canceled indefinitely, at least in person. I can't refer them to partial patient hospitalization or inpatient treatment programs because those are essentially shut down, all but emergency use. I have very, very few resources. What I am doing is I am unfortunately increasing emergency medication use such as benzodiazepines, which is the Xanax and Valium family of drugs, which are highly addictive, which I try to avoid as much as possible because I really don't have anything else to offer them. And I just want to keep them going until I can get them back to my practice and get them back to their normal life. To illustrate how severe this problem is, I'd like to describe a recent tragedy that happened in my practice. For the first time since I opened 10 years ago, I lost a patient due to unnatural causes. She was 31 years old. She was physically very well, no health problems. I had been seeing her for several years for depression, very serious depression and some mood cycling. She was on a cocktail of several medications. She was stable. She was seeing a therapist twice weekly, doing quite well. She had a remote history of opiate abuse for which she was abstinent and had been since I had started seeing her. She was due to see me this week, actually. And 1 week ago, I received a phone call from her stepmother, who lives in Atherton, where this young woman is from. She lives in Los Angeles, to tell me that she had died. I asked what had happened, and apparently, while she was going to school at Indiana College to get her master's in counseling, the school shut down, as all of the schools have from K to graduate. And she had to return to her apartment where she lived alone, confine herself to a small space, no family, no boyfriend. She had no 12-step or AA meetings to go to offer support while she was under stress. And unknown to me, she declined. I didn't hear from her or from the therapist. And about a week ago, because she had nowhere else to go, nowhere else to turn, she found a supply of fentanyl and she overdosed. She was found unresponsive by paramedics and she died. Well, again, she was healthy. She was
So Dr. McDonald, obviously, what a tragedy, and I'm so sorry. I can only imagine as a physician having a patient that this happens to, how it affects you personally. And this is a death that has nothing to do with a viral infection. This is the consequences of the unnecessary economic and medical shutdown in our country. And I know you're just but one doctor practicing, and this is being repeated over and over again across our country. So I'm sure you're hearing from other psychiatrists and healthcare professionals, and this is not unique to you. This is going on throughout the country. Is that correct?
It's going on everywhere. The director for the D.D. Hirsch Suicide Prevention Hotline was interviewed by the LA Times in early April. She manages the entire suicide prevention network in Los Angeles County in a clinic, a private practice, basically, a private outfit. And the calls that increased from the month of February to March went from 20 calls to 1,800.
Wow.
20 to 1,800 she reported in April between February and March. So if that isn't a signal that there is a tremendous number of patients and non-patients, just residents here in LA that are suffering such distress that they need to call a suicide prevention hotline, how many more of those people are out there? And how many of them are either now dead or are suffering in silence, avoiding seeing me, seeing you, seeing any physician that they need healthcare from? And the consequences will be really dire.
The mental health crisis across our country as a result of the economic and medical shutdown is quite dramatic. And as a primary care doctor, I'm seeing this in my colleagues as well, where routine visits are just not happening, both for mental health and for regular health problems. So I think it's a tragedy, and we hope that our message gets out that we need to open up our economy and, most importantly, open up our healthcare so patients can start getting the care that they need to prevent tragedies like the one that you are describing. So thank you very much, Dr. McDonald. I really appreciate you sharing your story. Hang in there, and hopefully there'll be a light at the end of the tunnel soon.
I hope so too. Thank you, Dr. Barkey. Good to be here.
Thank you.